Hey Frontline, it's Val. I'm back with more on understanding lab work. Last time we left off with talking about the complete blood count, and so now we're going to start with the complete chemistry panel or chem panel. Who needs it? Everyone with HIV, everyone taking medication that may affect the kidneys. How often? If someone's on meds, particularly HIV meds, usually every 3 months. If not on meds, at least once per year. And what does it tell you? How well the kidneys are functioning, the levels of electrolytes in your blood sugar. And I actually just want to go back and say that oftentimes the way that I think of the chem panel as being organ function. So it's all sorts of different things that are manufactured by the different organs in our bodies. And if those levels are out of range, it can tell you that there's something up with your organs that you wouldn't otherwise have a sense of. So another panel that's often done is the GI panel or the liver function tests, LFTs. And so everyone knows that the liver, this football-shaped organ right in the middle of the body, is really important in daily functioning. And everything that we eat, drink, smoke, ingest in any sort of way has to go through our liver to get directed to where it needs to go. So doing liver function tests is really important, particularly if someone's on a lot of meds, or even not a lot of meds. If someone's on meds, there can be impacts on the liver. So who needs it? Everyone with HIV and hepatitis B or C. Everyone taking medications that may affect the liver. How often? Well, if on meds, that's another thing that we check every 3 months or so. If not on meds, at least once per year. And what does it tell you? How well the liver is working. And it may indicate if medications. Good morning. It may indicate if there's anything that's harming the liver. So that can be medications. It can be hepatitis, which is sometimes viral. There are viruses that cause hepatitis, but hepatitis can come from other things besides viruses. Chronic alcohol use can harm the liver. So these tests, the liver function tests, can tell us, give us a sense of how well someone's liver is doing. The next set of things that we'll talk about that happens is STD screenings. So that is tests for STDs other than HIV. Who needs it? Everyone with HIV. Everyone with risk for exposure to an STD. And how often? Once per year at least, more frequently if at risk for STDs. And what does it tell you? Whether or not someone is currently infected with syphilis, gonorrhea, or chlamydia. Those are the three kind of big ones, although there are a lot of other STDs. And so you will often see these referred to as GC, RPR, and this is what it means: syphilis, gonorrhea, chlamydia. There's also a screening test for herpes, or HSV, herpes simplex virus. And there's a lot of web resources on STDs, so if you feel like you need more information, let me know. Lipid panel is another important piece of blood work that happens, and who needs it? All adults. How often? At least once every 5 years. More often if someone's on meds for cholesterol or on HIV meds that can affect cholesterol, which are a lot of them. And what does it tell you? Levels of total cholesterol, triglycerides, LDL, and HDL. And in another section I talked about LDL and HDL. The way that I remember which one's the good cholesterol and which one's the bad cholesterol is LDL is lousy and HDL is healthy. And HDL the good kind of cholesterol actually helps to scrub out the bad kind of cholesterol. And the good cholesterol comes from nuts and seeds, and sort of unsaturated fats, whereas you can probably guess where the bad cholesterol comes from, which is that egg and cheese sandwich that I ate the other day. Hepatitis screening. Here is a severely damaged, severely scarred liver, and it's scarred from hepatitis. Who needs hepatitis screening? Well, everyone with HIV at least. How often? At least once. May need to repeat the test if there's a risk of exposure, or to make sure that the vaccines worked. And what does it tell you? Whether or not you've ever been infected or vaccinated against hepatitis A or B, or infected with hepatitis C. We don't have a vaccine for hepatitis C yet, but we do have vaccines for hep A and B. And so if somebody has gotten the vaccine for those, the screening test will show that they have been exposed to it. But it's only a viral load test that would show if there are viral particles in the blood. The screening test that we do is an antibody test. So here's Hep A, Hep B, and C tests, and those are I really like the design here of the viruses. Who needs it? Patients co-infected with hepatitis B and hepatitis C. Anyone who has those viruses. How often? At time of diagnosis. So this is, remember how we talked about the HIV test, the screening test that we do to see if someone's positive is an antibody test, but then there's a separate viral load test to see how much virus is in their bloodstream. This is the same thing. The last slide was screening test to see if the body had ever been exposed to hepatitis viruses, and then these tests that we're talking about here are the actual viral load tests. So we want these work similar to HIV viral load test to monitor response to therapy, to see if the virus within the body is responding to therapy. If it's going down, if the viral load level is going down, then yeah, the virus is responding to therapy. So what does it tell you? Type of HCV infection, that is its genotype. The viral load, which can tell us about how the virus is responding to treatment, and then FibroSure is a test that determines the degree of damage or fibrosis to the liver. Liver biopsy is a more invasive alternative to determining the degree of damage to the liver, and so basically they stick a needle through the skin into someone's liver and take a slice of it. And it's not a lot. I say slice, but I mean a small sample of it. But you can imagine that's a really painful procedure. So FibroSure is a less invasive alternative to figuring out how much damage someone's liver has taken. Here we are at PSA, prostate-specific antigen, and here's a picture of the male reproductive tract. PSAs, any men who are over 50 years old, and we might start doing this screening earlier if they have risk factors for prostate cancer, so if there's a family history particularly. I would actually revise the slide to say anyone with a prostate, because there might be people who identify as women who actually have prostates, who are transgendered, and it would be appropriate to do this particular lab work for them. How often is this done? At least once a year, over 50. Rectal exam is also required for screening. And what does it tell you? Whether or not further testing is needed to check for prostate cancer. Testosterone levels are really common, and this isn't just for men also, although that's generally who gets it. Here are some testosterone supplements, And who needs testosterone screening? Men with symptoms of low testosterone and people who are receiving testosterone replacement therapy, who had low testosterone and get testosterone supplements. How often? When symptoms present? 2 to 3 months after starting testosterone replacement. And what does it tell us? Whether testosterone levels are low, possibly explaining symptoms. If replacement therapy is restoring testosterone levels. So that's where I'm going to leave it right now. And I will cut you. I will not cut you. I will see you after the jump. Okay, bye.